you have to know the stages. There's so many classifications. I think the easy way is to divide them into 5 stages. The ages may vary. If you read certain books, it's different. So an infant is usually 0 to 1 year old. And I think that one is always constant, okay? But when you get to the toddler and then preschool ages, some people will change it. So 1 to 3 years, I think is the best time for a toddler. So, and then the preschool before they become big men and women is 3 to 6 years old. And some people would change it to 3 to 5 years. I think 3 to 6. And the school age, yeah, that's when they start bothering you, 6 to 12, 6 to 12 years old. But like I said, it's plus or minus 1. And adolescents, I think I call them adolescents. They are not truly adolescents, but that's the way we describe them. Is 12 years and above. So plus 12 years. So this is the 5 main classifications. So whenever they ask you a question, I want you to come back to this picture. So there's 8 stages. They are not hard to memorize, but I don't memorize it. I think about what is going on. And as we talk about it, you can see that, oh, this is what is happening. I remember. So infancy, like we said, 0 to 1. What do they do? When the kids are very young, you give birth to them, the first person they're looking for is their mommy. They look into their eyes. That look into their eyes is what we call intimacy to me. The reason why they're doing that is to trust you. So trust is the first thing the kid will do because they are in the womb, they're alone, they love where they were, but then when they grow to a certain age, they say, no, I need to come out and explore. So as soon as they come out, they start crying and they're looking up. And then they look into the mother face and they say, oh, okay, this is the one who gave birth to me. So every time you're holding them, they're looking at your face, looking at you. And I think that's where they establish the trust. So this is the stage they do that. They need to attain that trust and it go all the way to the 1-year-old. If they don't attain that, they mistrust people. Okay, so that becomes a problem. So the first stage is the trust and mistrust. And what will happen? What is their behavior? If you trust somebody, if you have wife, girlfriend, boyfriend, if you trust them, then you are hopeful. You know everything you're going to do. You know they're going to support you. So the behavior is hopefulness. Okay, so that's what they will attain. The kid is hopeful. Mommy is going to be there to feed them, to provide for them. So hopefulness. So I'll try to make this very practical so that it will make sense. So hopefulness and trusting. If the kid doesn't trust you and they are not hopeful in doing things, they will be withdrawn. So that's the side effect, like not the side effect, but that's the question when they ask you, a kid who never attained trust and therefore it will end up being mistrust, what behavior would they show? Yeah, they will be withdrawn. They don't trust anybody in the family. They like somebody is going to harm them. So they will be alienated, like alien, So that's the problem they will suffer. Like I said, this subject is a little bit raw, but try to make it practical. So this is the first stage, and that's the problem. So when they ask you a question, 1-year-old who have not attained that milestone in terms of growth development, yeah, this is what they're going to have. So they will be hopeful or withdrawn. But the actual stage is the trust and mistrust, and then the behavior is that. So then we go to our next stage, 1 to 3-year-old, which we already talked about, the toddler. Then as they grow, the toddler stage, okay, that's the 1 to 3 years old. If I trust you, okay, and I've attained that trust, I start to take autonomy. Like, oh, I'm on my own now. Mommy will watch me if I fall. You know, if they don't trust you, they will be always hiding, withdrawn. You know, so the next stage at 1 to 3 years, they know mommy. They develop that trust, so they will have autonomy to do anything. I mean, they have self-control basically. If though you don't have autonomy, you shame. Okay, so that's the problem. That's that stage. Autonomy versus shame. And that's what will happen to the kid. So the behavior is self-control. Okay, I have power to do anything. So willpower. Okay, like I said, trying to make it practical as much as possible versus what? Uncertainty. They have no autonomy. They can't make a decision. So they're uncertain about things. So 1 to 3 years old, when you ask them to do something, they confused. Like, hey, what do you want me to do? You know, they lack, you know, uncertainty, basically. So that's that problem. Then the preschool, when they get to like 3, the preschool age, they're 3 to 6 years old. Now we have 10 trust, okay? We have autonomy. What do you think the kid will do? Initiative. You start to do things like on his own, right? You take initiative in class. He'll be raising his hand. I mean, he's not afraid of anybody because of what happened at home. So it will be initiative. If you are not initiative, well, what? You feel guilty. You can't even raise your hand in the public. You don't want to speak, you know? And then so in the classroom, they're always quiet. Just because you're quiet doesn't mean you do not attain that stage. I'm just using it as an example. So very, very initiative in their action. They can take initiative in any job that they do. If you take initiative, then if you are affected, the other way will be you conflicted. You can't do that. So that's the difference between these two. So that's the behavior. So preschool ages group. Like you said, this is a little bit raw, but I tried to make it like a little bit funny and nice. Then the next stage is the school age. They're growing old, but you see what will happen. You can think about, compare it to yourself as you go through it and see what happened in those stages for you. I trust my family. I've attained that trust. Because of that, now I have autonomy to do anything. I can take initiative. What will you think will happen? You're becoming more industrious. Like you are a go-getter, basically. You feel confident, you're competent, like all these things is falling in place. So these people are industrious. Okay. Versus inferior, which is the same or close to the guilty, the inferiority. So they don't attain that stage and they get into trouble. So being competent and feeling low self-esteem, that's the problem for them. So these people are competent and confident. It is low self-esteem. Now, this is what affects them. We get to the adolescent age now. If you've not been able to attain this stage, you feel you don't have industrial. I mean, you are no initiative in attaining work, and you don't feel like you have the autonomy, and you don't trust anybody. You don't trust anybody. You don't have autonomy. You can't take initiative. You have low self-esteem because you've not attained industrials. Guess what? In adolescent age, you get conflicted. You get conflicted. So this is what happens. So identity. This is where they go crazy. They wear a certain dress, I mean, I have an adolescent in my house, so I know what identity versus role confusion. They don't know who they are, just like they want to be everybody, They get dressed like any way they want, and that's the problem because there's some stages they've not attained the full potential of that. And that's the age of 12 to 20. So this is the 12 to 20 age. And then in the future, a young adult. That's the problem, you know. Young adults, they are 20 to 35 years old. You can think about what will happen. You don't have you don't know who you are. How can you be intimate? So this is where the intimacy come in. And if you don't have intimacy, well, you're alone, isolation. So that's why I said Erikson is the best guy who is able to describe, and you can see this in real life. You know, the young adult, 28, after the 18, get to 20, they couldn't find who they were at the 18, and the past 20, they're in college. Now, well, 21, you got to find, you know, somebody partner, and you lack intimacy. And then and if you don't have it, you become isolated, and you stay in your room and you play a video game. So that's what happened. You know, you can't maintain relationship because you don't trust anybody from the beginning. You know, so that's and you feel uncomfortable, so you isolate yourself. But if you attain that 20 to 35 and you have intimacy, well, you make babies, right? So that's the middle adult. So the middle adult, 35 to 65. Now you have intimacy, you feel like you're on top of the world. So generativity, you know, you just like, you have obtained whatever you want in life. You know, you have achieved anything that you want to achieve. And you see your kids, and then you see yourself through them. If you don't achieve that generativity, you stuck in that isolation stage. So that's stagnation. So because you isolate yourself, you'll be stuck in that stage until you're 65. You know, you don't have a family, nobody to look after you because you couldn't attain that stage. And then we see them all the time, older people who have done whatever they want to do. So older adults, so over 65 years old, they've done what they want to do. They take vacation now, nonstop. And that means the integrity said, I've achieved whatever I want, sense of accomplishment, you know, integrity. They've achieved whatever they want to achieve. And if you don't have sense of accomplishment, you have despair. So that is the problem that they will suffer. And this is Erikson stages. And this is how they can ask you questions. So you have to know the stage. So I recommend you know one side. So that's the way I remember. If I trust you, the opposite will be I don't trust you, mistrust. If I have autonomy, then you can achieve. Even those who don't have autonomy, they're always ashamed of themselves, you know. And if you can't take initiative, people who take initiative, they don't feel guilty about anything. So you learn one side and then you compare it to the other. If you're industrious, yeah, inferior. You know, some kids, they all over everybody face, you know, then a competent self-esteem, adolescents. So that's how you can remember them. Just because nobody can achieve all these stages. So just know, I mean, we always have shortcoming, family life, things happen. I mean, so that's why we develop egocentric personality disorder. It's all come from these stages. Like there's nobody who's perfect. Okay, you have to have problem in the line. Things happen. You may achieve that intimacy longer time because of things you want. I mean, but it's fine, you know. But for your test, just know. I mean, this is what is going to happen. We want it to be smooth, but it's never smooth. Any questions? So that's the stages right there. Okay, guys. Sorry, it's raw. So I'm going to clean this for right now. And then now we're going to take each stage and see what they usually attain. I think that's where they focus on. I'm just going to focus on, for the infant, only the first 12 months. You can go and look for the other ones. I don't think they ask questions on that much. I think the infant year is because if you can grow the first 1 year, I think is the most important. So that's why they pay attention to that. Okay, so we'll take each individual and then talk about the stages that they're supposed to attain in terms of motor and skills that they're supposed to get. Okay, but before that, for the infant, the certain reflexes they always ask. I mean, sometimes they're annoying, but I think it's very good because they are primitive reflexes that are supposed to go away. So these are primitive. It's supposed to go away, but then if you persist, we know that there's something wrong with you. Okay, the moral reflex, I think, is what they like asking, and usually it's supposed to, the kid, they hear a sound and then they both their hand and the upper extremity is lower. It's like they are afraid of something, but that's the adaptation. You know, they raise up like, hey, they get started. Basically, it's an adaptation to be alert. You know, adrenaline kick in, and then that is normal, but it's supposed to go away by the third month. Okay, it's supposed to go away. So by the third month, it's supposed to go away. If you persist, then if you examine, they give you a question, you examine a kid and you still have it, then you know that something is wrong. And then think about it. When they're very young, anything you put in their palm, they grab you like really, really tight. Like, hey, I'm not letting go. Yeah, the palmer grabs. That's what they like. The reflexes. It's supposed to go away. And by 6 months, it should go away. But if it doesn't, then we got to figure out what is wrong with the kid. So this is 6 months away. This one too away. It goes away. So, and the third reflex is the Babinski. You guys all you just basically you when you stroke the undersurface of their sole, basically their foot, the toes will fan out. You fan out when you stroke the bottom of the foot. It fan out. It's supposed to do that. That's normal, right? It should go away in 12 months. So Babinski. So that's I think the oldest reflexes that stay longer by 12 months. So fanning out of the toe. When you stroke the undersurface surface of the foot. It's supposed to go away by 12 months. If it doesn't go away, usually there's a neurological problem, okay? Neurological. So if they ask you that, look for a neurological. The most common ones are usually autism or cerebral palsy. This is the most common, two common diseases. I mean, a neurological problem when somebody, Babinski, persists more than in 12 months. And that's where they will trap you yet. So these are the reflexes I want you to pay attention to. Very, very important. The three reflexes and what time you go and what it means. Any question? So the other motor function is now, this is hard, but you have to, if I were you, I would spend time. The first 12 months, all the motor function, I know, because they were actually 2 months, 3 months. Who cares about that? But that's what they want to trap you, you know. So for gross skills, okay, gross motor skills, that means the whole thing, okay? Gross motor skills for kids. So I don't know, you may probably know this already. 1 month, I'm just keep giving you the reason why it's called milestone. There's one specific thing you should do. The kid will do multiple, but one specific, like this you have to do if you are that age. And if you can't do that, something wrong. You may be doing all the rest, but I want you to be able to do this specific thing. And that is the most important. That's how you can remember this milestone thing. So one thing I want you to do at 1 month, yeah, you have to be able to let your head lead you. So head lag, basically. They should demonstrate a head lag, basically. If they do that, that's good. Okay. And they are fine. I'll put both together. I'll put the fine model so that we can get this thing done quickly. I don't like talking about it because it's painful. So fine model is different. Fine means that means it's specific. You know, like you're taking a salt in the a grain of salt out of a bunch of them. Yeah, that's really fine. So they can do something specific that require a lot of neurological interaction to be able to achieve it. So that one, they can hold their hand in the what do they call it? Open position like that. So hand in open position. That's really fine. And to be able to do that. And that is really, really good if they can do that at 1 month. Then at 2 months, we go back to the fine model, the gross model. 2 months, they should be able to lift their head up in a prone position. So head is coming out from the prone position. Now, first the head is lagging, but now they can lift it up. If in their prone position, remember, then they should be able to do that. Head in the prone position, lift it up from the prone position. You may probably know this already, but these are some of the things they need to achieve. Very, very important. Okay, and these two, they can interchange, you know. The hand in the opposite position can still be there. Okay, hand in the open position. And then this one, we talk about the palmar grasp. So here is very prominent. Okay, they still have the grasp here. I should put it there. They can grasp things really, really strong and grasp reflex. They can hold the thing really hard. So those are the two modal and fine modal activity. And 3 months, remember now they are in the prone position. They have lifted their head up. They have to lift the whole upper body. The upper body is now coming up. So this is when they can lift the upper body, not just the head. They can lift the upper body. And so if you're 3 months, your head should be able to lag. Then you improving, you lifting the upper body in a position so they can bear weight, basically. And this is where they start to lose the grasp. It go away, okay? The reflex go away. Then then because they can open their mouth, they can hold a rattle. Yeah, I want you to pay attention to that. Listen, they can hold it really, really well. And they can keep, they don't grasp it anymore. They open it slowly, and you put something there, they can hold it in the fine model. And that's why they can hold it, the rattle easily. And the 4 months, they roll. They've been able to lift their head up. They lift their shoulder. What do you think? They try to get up. So they will roll as they try to get up, then before they realize they're flipping themselves up. So they roll in from the back to the side. So they're rolling back to side now. So it's interesting when you think about it, but it follow progression. So that's why they call it milestone. So rolling from back and to side. Remember, they'll be able to hold a rattle. First, they can grasp the thing, and then they open their hand. So you can think about it. I grasp it really tight. I don't want to let go, but they realize, oh, the thing is not going to get lost. So they open their hand, and they can hold a rattle at 3 months. And then 4 months, what they can do is they can pass the object. So they can hold the object with both hands initially. So they hold it and say, oh, I can bring my left hand to hold it and support it. They are turning that neurological thinking, like, hey, if it's in my hand, I don't want it to fall, because initially they think it will fall. That's why they grasp it tightly. Then they let go slightly. Then they hold a rattle. They say, oh, let me bring my left hand to support it. So that's why they can hold objects with both hands. So if you think about it, it all makes sense. And at 5 months, if I'm rolling from back to side, well, before I realize I'm going to go from front to back, because you go into a circle, front to side, then boom, you have moved from your front side to your back. They flip. That's why they flip from the chamber. So from front to back. You got to be careful when you get to this stage, when you're changing them. Now, they because they can pass objects, they hold it with both hands. They can gently take the object on their own. Now they're picking it. They can voluntarily, they can grab it, and then they can take objects and they can put it in their mouth, because that's their feeders. So they put stuff in their mouth. They can put it in after they grab the thing. Then the 6 months, we talk about the palmar grab, so should be completely gone. If it's there, then it's not good. You remember they are from the front, they move to their side, then from the front to the back. So now they are on their back. They can flip from their back to their front now. So that's the first 6 months, and very, very critical. And if the kid is not achieving that, then mommy will be worrying. Mommy will be worried about it. Then they will start trying to get up. Okay. They try to get up. I'll be able to flip back and forth. Well, now I got to go to my leg. My upper body is strong now. You can see these are all upper body movement. Now they try to go to the lower body. And this is where they will start to bear weight on their feet, and they can sit. But when they sit, because the upper body is now stronger than the lower body, they lean forward. If it makes sense to you. The upper body is strong. The lower leg is weak. It can't stand on it. So they can sit, but then they lean forward. All the thing they were doing in the first 1 to 6 months, they're trying to achieve upper body, but the lower body, they were not using it. They are stronger in the upper body now. And then if they can pick object from the floor, where they can move it from one hand to another. So I'm trying to explaining to you why it's occurring as much as I can. I know this is painful. Let me see. Where is the cleaning? So let me clean this one here. Okay. So we are on the 8th month. 8th month. We're growing slowly. We will be there. Don't worry. We are almost there. 8th month. We're better now. If they're leaning forward, now they realize that no, they can sit upright because they're stronger. So they can sit unsupported. So this is where they can sit unsupported. But what can they do? Fine motor. Now they're passing object from one hand to another from the 7th month. And so you can think about it. If I can pass object from one hand, I have to grab it in a certain way to give it to the other the other hand. And your fingers are what is controlling those fine movements. Now, this is where you achieve those pencil grab. You see, your thumb is controlling. You can't pass an object without your thumb playing a bigger role. So they use their thumb and the index finger in the pencil grab way, but they've not achieved it properly, but they're almost there. So they can pass objects, but so here I call it development of pencil grab. It's not completely achieved. So their thumb and the index finger is what is doing now. They are not using all of them. So development of pencil using the thumb and the index. I mean, that is the easy way to explain it to you. But some people may say pencil. I don't think they've achieved the pencil. The pencil grab is where they go to the 9 months. That's the key. They have more advanced way. Okay. Now they have to start getting up. It's getting late. We got to walk. Okay. We got to walk. So they use their hand and their knee to get themselves up. That's how they start crawling slowly. They're crawling. So I'll put crawling here because they're trying to get their leg stronger, but their leg is not that strong. So they use their hand and the knee instead of before crawling. They've not achieved it completely. So they can't crawl because the lower leg is not strong. So they use their hand and the knee. Instead of crawling, they'll use that. So the crawling is the form of hand and the knee, not the true crawling. Okay, and then I said in the 9 months is where you have the pencil grab. Through pencil grab, as you find motor skills. And 10 months, that's a big part. That is the biggest part, okay? We have to move from a prone to a sitting position because now they're developing their legs now as they try to crawl with their hand and the knee. If they are in the prone position, they can just get them push themselves up with their hands and their knee, and they will be up, sitting down. So prone to sitting position. So that's the easy way to get there. And then at 10 months, well, they can grab the rattle by their hand right now instead of holding both hands. So the rattle grabs. It's better. 11 months, I don't pay attention to that much because now they're walking, holding something. Okay, they're going to walk. So this is the beginning. I think they will push you to the 12 months. So walking, holding something. So they're just holding something to support them because they don't trust their leg. They don't trust their leg at all. But because they've developed a pencil grab, guess what? I can pick the thing up. So I'll drop it and pick it up intentionally, and I can do that easily. They start to do that instead of holding it to say, oh, that's how they learn it. They pick it up, drop it, and then like they're playing on their own. And they place the object in the container and then go and get it. So that's how they're developing themselves. And finally, at the 12th month, they go into do what they've been trying to do from the beginning. They're holding things. Now they can sit down, even though they can sit from the standing position. Their leg, now they trust their legs. So sit from standing. I think that is the biggest milestone, and they can walk unassisted. So walking now, they have to be walking. Some of my kids walk at 12 months, some doesn't, things happen. And because they can do pencil grab, this one, they can hold 2 blocks. That's their fine motor function. So 2 blocks, I'll put it here, 2 block object, they can hold 2 blocks. And these are the milestone. I mean, I will spend some time and then try to like understand them as much as possible. They're a little bit difficult, but if you know some strategy, yeah, I mean, this is the way to remember them. The 13, 14 months, I mean, I don't worry myself too much about it. I mean, I don't know. But I think this is the most important. If the kid able to achieve all this, then the 13, 14 months, they should be fine. There shouldn't be any big problem in terms of their development. But this is where the doctor pay attention and see, okay, we're growing and we got to get there as much as possible. So those are the biggest milestone in terms of motor function They are really hard to attain. Not every kid attain them at the right age. Some kids who still can't walk until 13 months, 14 months, mommy will be not happy, but that's the best way to get a broad picture of what happened at the 12 months. Any question? Okay. Let's get to the fun stuff. I like the fun one. The motor one is raw. So the social aspect of it, they are not just growing in motor way, but social, they have to show you that they are there. Okay, baby, are you there? Yes, I'm there. The kid will say, I'm there. So they start to smile. So they have smile. This is a social smile. Anybody that they know, they give them a smile. 2 months. We got to see that. Okay, we got to see that in 2 months. And then in 6 months, they start to worry about strangers. So stranger anxiety. Yeah, this is 6 months. Okay, they start to worry. If they see a stranger, they frown their face. They go, no, you don't belong here. And then at 9 months, they have separation anxiety. They know mommy has to go. Mommy can't be here all the time. So they start to worry. So separation anxiety. You just have to know the months and when it happens. So separation anxiety. So these are the social stuff that happen to the infant. They have to achieve that. It's okay to be worried that mommy has to go. I mean, but that happened at 9 months. They start to like worry. Then the verbal is straightforward. Some people are very good at what the kid is supposed to say. They will start talking, right? They will talk. They will listen. They will hear you. So those are the stages. They have to be able to hear you. They have to be able to look at objects and know what it is, and they have to talk. So those are the stages. So do they recognize your voice? Yes. So they have to arrange voice at 4 months. They have to do that. But then by the 9 months, they should know their name. So when you call, hey, John, they will turn their head. But at 4 months, they know there's a voice. There's something coming. Something, I can hear it in my ear. They should hear it. Then they turn to it. And by 9 months, they know that, oh, this is me. They're talking to me, so that when they hear John, they turn their head to John, wherever John is coming. And because they've attained that information, they will know whether something, because if you can turn to a sound that is responding to your name, then you have achieved, I think it's a form of object permanence, object permanence. That means if you hide something, right, I can't spell it, object permanence. You hide something, they know that the thing is not gone, but it's still there. Right? That's what they say. I know I've heard some people call it Jack in the box, peekaboo, something like that. Peekaboo. Yeah, they know that the object is there. Even if you put a cover, you show them the thing and you hide it, they will go under the thing and see if I can find it. That's object prominence. They have to achieve it at the same time, 9 months. Very, very important. They know it's not lost. It's there. They know it's there. And the object is permanent. It has not vanished or anything like that. If you put anything you put on it, they'll go and find it. So yeah, you should know this information. And now they got to talking. This one I think is hard. Everybody know mama, dada, right? I mean, I think 10 months, they should be able to say that. Okay. But then be careful, okay? All this thing is related here, especially here. They hear the voice and what? They know their name. There will be something that will happen that the kid may know. The mommy will be worried. They don't follow you, they don't hear you, they don't, and that is the sign that something is happening. So you have to pay attention. They may ask you here. I know this is where hearing development, every time when my kid was young, this is what they're looking for. Are they having a hearing problem? So it can be related to other things. So the kid not listening, not hearing, he doesn't pay attention and everything. Yeah. Watch at this stage. They may trap you with hearing the development. It's not normal. It's not normal. The kid is not hearing appropriately. When you ask questions, they can't figure out what is going on. Yeah. And they may ask you what may be the possible cause. It can be family history that may be responsible for that. Okay. Sometimes it's just medication. You don't know that is causing the hearing development problem. Ear infection is also can do that. It may be just congenital problem or idiopathic. So when they ask you about hearing development in the kid at this stage, yeah, worry about family history, medication, infection, congenital problem, or we don't know. Okay, how would you know that kid is having hearing development? That's how you find out. They've not achieved the voice. They can't know their name. They don't attaining object prominence. And so the signs and symptoms you should watch for is the kid will be really, really withdrawn because they can't hear anything. What is going on? They don't trust anybody. They go back to Erikson, this thing, stage development. Okay. They withdraw. They are inattentive. They can't pay attention because they can't hear anything. I mean, they don't know somebody is talking to them or not. And you think they're ignoring you, but they're not. So if mommy, they give you a question, mommy, bring a child, they think the baby is ignoring. When you talk to the baby doesn't listen. You feel like he can't hear. A baby is like withdrawn, inattentive. Think about hearing problem, okay? And then the mommy probably will try to speak louder. Yeah, those are all signs of hearing problem in the kid. And so mommy will use what? Monotone voice, or they use a hand gesture, basically. These are clues that they're trying to lead you to a hearing development. And that's all I will say about that, because it's very important. This is where they don't develop well. Okay. That's the infant. Infant is very difficult. Any question? Now, toddler. We know that a toddler is like, they are the fun part, 1 to 3 years, right? Their motor function is straightforward, We're not going to do all of them, but when they are matured, getting to the middle of it, these people should be able to stack cube easily, because at 12 months, they're doing that. They're about to do that already. They can stack 2. So these people should be able to stack the cube easily. If I can put at the 8 or 9 months, they were putting objects in their mouth because they're developing the pencil grabs. Yeah, they can feed themselves. These people should be able to feed themselves, right? They've been walking and they're stronger. So I say kicking ball, it's okay. And this is some of the milestones they have to achieve. I mean, but to kick the ball, you have to be at least 2 months, 24 months at least, to be able to do that. So those are the things that they can do easily. And these are the key motor things, you should know. In terms of the social, well, it's straightforward, right? social, they'll be able to achieve whatever they achieve in the infant age. So they should be like able to achieve certain stages that is appropriate for that. No, they don't want to be around people anymore because they they involve in like a parallel place. So they don't want to be around anybody. They want to be alone, you know, they want to take care of themselves. They start to ask questions, you know, rationalization. I think that's the key part. They rationalize it. Hey, why? Why this? You know, I mean, and then they realize that what did they call it? Things are not the way it's supposed to be. So that's what happened at that stage. And they don't want to be around anybody. So and those are the key aspects in the social. It's not that great. I don't think they ask questions too much about it because it's something that the kid will know about. And the verbal, yeah, that's very important. They should be able to make like 200 words. If you can't do that, well, that's problem. By age 2, they should be able to do that. Yeah, they can make 2 sentences easily. If they can't do that, then that's a problem. So those are the toddler stage, nothing interesting. And then let's see, the preschool ages, the motor function is not that. I mean, I know the one that I remember is riding a bicycle because then that's what they they want to do. You know, they can drive a tricycle. Basically, they need a something to support them, and then they can draw a line because they have pencil graph, they have dexterity now. So these people, so these are the key aspects. Like I said, there's so many things that can occur, but I'm just giving you the key thing. I think that shows that they've developed. They have dexterity. Therefore, I can hop on one foot. They can do that. And what are the social things that they achieve? Remember Erikson, now they have autonomy. They've achieved autonomy in the point that they know they have no shame of anything. Okay, they are not ashamed of anything, so they feel like they have freedom. So this is the same. The social aspect is mostly Erikson stages. They have freedom. They can spend time away from their mother without any problem. They feel like they can have friends. They can talk without anything. And they are verbal. The reason why they're talking because they can make over 3,000 words easily without any problem. And they can complete a sentence. Those are the key aspect of them. And that's all those people. I mean, I think your test, they pay attention to the toddler, preschool, and infant in terms of what they can do. Okay, then let's see. Now we come to the play. This is sometimes confusing, but the word explain it. So you explain it easily. Okay, the way the play is implemented is explaining. Play is very important because it shows that the kid is developing well. We can interact socially and emotionally, and then be able to talk to people. So that's why it's very important. So for the infant, you know, they are egocentric. So they like solitary prey. Okay, they don't want to be with anybody. So this is egocentric play. They just alone. They play alone, even in the presence of other people. So they play alone. In the presence of other people. So I'm on my own. I walk alone. So that's the kind of play they do. And the toddlers, that's 1 to 3, they like, even though they don't like to play with people, they like to be around them, and then but then they don't play together with them. So they play next to them. Okay. The infant usually alone. Most of the time, they don't even want to play in the presence of people. They want to be alone, isolate themselves at all. But these people, yeah, they will parallel play. So we are playing together, but we're playing different. Okay, this is parallel play. So the definition sometimes can be, so these people play next to one another. Okay, but they're playing differently. They're playing different. They're happy to be around, unlike the infants. They don't want to be around. Happy to be around people, but they don't play with them. They don't play with them at all. So that's the difference between solitary and parallel play. Then the preschool, which is the 3 to 6 years, think about it. They more now, they have friends, they can talk, make over 3,000 words where associative and play. And what this means is we play together, okay, but there's no rules. There's no rules, there's no leader, nobody is in charge, there's no boss. We just do whatever we want to do. And when we finish, we say, okay, so they play with similar activities, right? It can be the same object, okay, same object or different object. So if they ask you, it's the same object, different object. But there's no rules, okay, and there's no leader, there's no boss, okay, there's no boss that this is the way we have to do the play. No, there's nobody around. So, and they can borrow items from each other. So there's no, like they're building things, but there's no leader who's in charge. Nobody, and this is where they do like imaginative, these are the people, they do imaginative play. But the key is no leader and there's no rules. Okay, nobody is in charge. We just playing whatever. You can't tell me what to do. You can't assign work to me. If I need to do something, I will do it with the play. But the school age is the most painful one. You got to deal with other people. So this is the cooperative. You cooperating, okay? Associative, you are associating yourself with me so that we can play. But I'm not going to tell you what to do. We don't have a rule. We don't have any plan. But this one, we have a rule. There's somebody boss there, the boss. We play with each other, okay? Play with another. But we have ground rules already established. So there's rules and there's a leader. It tells you what to do. So like we're building a Lego. Yeah, you do this, you do the head, I do the tail, I do the leg. Basically, somebody is telling you, yeah, you have to do it, like building a block, and we want to create something. Or Legos. Yeah, I'm telling you what to do so that we can get this job done. That is how you can distinguish between them. So these are the play that you need to know. They usually give you either the definition or they will give you the play, and you have to figure out what exactly it is. So solitary play, that means infant, alone, egocentric. I don't want anybody to be there. Toddler, parallel play. I want you to be there, but I'm not playing with you. You playing your play and I'm playing. Like parallel, two lines parallel to each other. They don't intersect. That's what the way parallel. A parallel lines don't intersect. That means they don't come together. So they move in the straight line. If you see streets that are parallel, they don't intersect at all. So they parallel playing. We don't talk to each other. Associative, yeah, there is a connection between them. They can play together, but there's no boss, no leader. No, just let's do the play, and when we finish, we take our bag and go away. The school age people, no. There have to be some lady or a male who want to be the leader. Okay, let's do this so that we can do a good, so somebody have to be in charge. And then that's the difference between all the plays. Any question? So that's the difference between them. Okay. Now, death. The reason why I'm doing is because I know they are like asking. I mean, these are clinical things that will pop up, and you say, "What? I don't know what it is. What am I supposed to do?" Yes, you have to know our perception of death for these kids. What do they think about it? How do they deal with it? In the question, I mean, when they ask you, so that you know. So the same thing. You can think about it from the infant, birth to in 2 years. So birth, this one is straightforward. So birth, 2 years. What do you think? I mean, do you think they understand somebody die? No, they have no clue. So when they answer question, just don't freak out, worry. Just pay attention. So a 2-year-old, I don't think you know what death is. So no understanding at all. So if they trick you, you have a 2-year-old and somebody die, do you tell them about it? Well, they have no understanding of the death. But what are they worried about? Very sensitive to the lost. So that's the key, sensitive to the lost. Because of the separation, remember the separation anxiety, they get distressed about like empty environment created. So distressed about it. Even though they have no clue what has happened. They know emptiness, I guess I'll put the emptiness. They know that there's a vacuum created, but they have no clue what happened. They know the understanding of that. What do you mean by that? By mommy, daddy is not going to be there. Auntie, so and so is not going to be there. Brother, so and so is not going to be there, but they have no clue. So you don't have to tell them anything about it. They have no understanding, no discussion about it. But I know sometimes parents trying to explain it. 3 to 5 years, okay? These people are different. They are the people I call them the magical thinking guys. Every time you hear about 3 to 5, those age range think about magical. They think magical. They play roles like, Superman, all those things. So they believe, they believe that is something that will basically reversible because they think magically. I mean, what is it? Cinderella, those kind of thinking. So when it comes to that, go back to your movies you watch. I mean, and it's true. So they believe that this is reversible. It will come back. I've seen Cinderella before come back, and so they start thinking magically about it. Oh, this is something that happened. So hopefully it will come back as usual. They have no clue about it. This is how they think. So magical thinking. So when you're explaining to them, you got to go to their level to figure out what they understand. And then the 6 to 9, those they understand. They understand the concrete, okay? But it's very difficult for them to pay attention to that. To understand concrete, this is the key word, concrete finality of death. That means it's final. But they find it hard to understand. Understand it because they think about themselves. Now they start thinking about their own death. How is it going to be like? I mean, I don't understand. They have a concrete idea, but they cannot fathom what it's going to be like for them. Okay, so they've not been able to achieve the final aspect of death, but they understand the concrete finality. Okay, it's a little bit different. They know that something is happening. The person is not coming back. So they start thinking about themselves, okay, about what is going to happen to them. Then when you get to the age group 10 to 12, yeah, this is the one that they know that death is final. It's final. And it's affect everyone. Everyone is involved. Everyone will be affected. Everyone will be affected. And the last one is the adolescents, okay, after 12 years old. They think like you, the adults. So adults, the way you understand that, and you know it's inevitable. So I try to give you the key words, you know, these people inevitable. Death is like, it's not even final. You cannot avoid it. So it's inevitable. And they understand difficult concept about that. They can explain it and they can apply religious and spiritual application to it. So I just put the keywords. These people, they know it's inevitable. 10 to 12, they think there's a final death and how it affects. The 6 to 9, they are attaining the finality of it. 3 to 5, they think is reversible. And birth to 2, they have no clue about it at all. And so you can put all of them together. And so you see the question and say, oh, okay, this is where we fall into. Okay. Questions. Very, very important when it comes to taking care of these kids. So for the infant, pain is a big problem. Okay, so you have to be really, really nice. Okay, you have to be nice when you're taking care of them. You have to be, because they can talk, so you got to try to be nice as much as possible. Because they can feel pain, okay? We should provide pain medication, no actual pain medication, pain therapy, okay? Provide pain therapy during procedure as much as possible. And how do you do that? They like asking you, and I call it the 4S. I mean, it comes in the 4S. If you see a question, it's the same thing as, it almost look the same thing as, yeah, I use the authority of Foley, what you do to them when they really, really agitated in stress, that will increase chanting and they become cyanotic. The same thing you do for these kids. You try to think about that. That you have to throttle these kids, hold them together, and let them know that they're back to their mother's womb. That's the way they feel comfort that way. Or just put something in their mouth. They like things in their mouth. Okay, you can give them a pacifier so they can suckle. Okay, suckling. I mean, put a pacifier. It's fine, so that the kid doesn't cry. And then the same thing, think about it. In tetralogy or fully, you hold the kid to prevent from chanting too much. You swaddle the kid, you touch the kid, skin to skin. You touching them so that they don't cry. They feel safe. So skin to skin. And finally, if it doesn't help, you put something, you can give them glucose. So sucrose, they can suck on. So these are the 4S. If you have a 1-year-old and they ask you a question in a SATA form, yeah, you should do all these things. Swaddle, suckling, skin to skin, and give them sucrose. And then that's how you can take care of their pain. Okay. If you have to do a procedure or blood, usually they give them immunization or something like that. You have to draw a blood. Don't draw it anywhere than a heel stick, okay, on the lateral aspect of it. It's very, very important that you do that. So don't do stick that is really bad. And they usually get a heel stick or immunization. Those are the one, they don't like it at all. This is very, very painful. And so this is when you should provide some tender loving care for these kids. You shouldn't do anything other than that. What are your interventions? Yeah, this is very important. Okay. And then they like asking that when they ask you The clue is if the parent, and place the infant close to the nursing station if there's no mother around. So place them near the nursing station if there's no mother around. But if there's mother around, let the mother be with them. So it's very important, okay? And then you have to provide the same caregiver, okay? Same caregiver has to be available. So the sameness, assign the sameness for the kid so that they become consistent with that. And this is the infant way of taking care of them. Provide the same provider close to the nursing station. If mother is not there, if mother is there, let them be with the kid. If they're going to have a procedure, provide some pen, okay? And the pen is 4S: swallow, suckling, skin to skin, and sucrose. So if they give you in a SATA form, make sure you're consistent with that. They won't give you that, but there will be buzzword, something that says swallowing, suckling, skin to skin, and suckling, okay? And that's how you do for when they're doing procedures. Then as we advance, let me see. Then for the toddler, you know, they're different, okay? They're different, and they like to explore, okay? They're different from the infant. They like to explore. But don't scare them, okay? Don't scare these people with instruments. Don't bring the needle and jam in to the kid, okay? Just try to make them feel comfortable. So don't scare them. Let the mother be around. So comfort from mother. Let the mother to stay around. Don't scare them from the instrument, okay? Don't scare them with it, okay? And try to make everything look normal as much as possible. They may feel comfortable if the mother is around. So normal setting, okay, for them as much as possible. And this will help them make the pain a little bit better to bear, okay? The same thing, they will need a consistent caregiver, and that will help with that. So this is the thing: comfort, don't scare them, normal setting, and sameness, basically, to be available for them. And this will help with the pain because mother is there. They're not going to be scared. Don't bring the IV right in front of them. You know, you got to hide them and provide a normal setting so that they won't be worried about it. That's the toddler. The preschool people, yeah. Remember them, they are the magical thinking folks. So preschool. Because they are magical thinking, use imagination, you know, explain to them, you know, oh, these, don't lie, but use imagination to explain to them that this is what you're going to do. Don't lie, like I will put it. Don't lie to them. That they like magical thinking. And to do that, and this will help them take away the pain. So whenever they're going to be a procedure, these questions are hard, but if you know what you're looking for, it's straightforward. Preschool, I have to do magical thinking for them. So I explain the thing in a magical thinking way. I don't lie to them, and this will help them. It will say, oh, you can use Superman, okay? This is what Superman would do with this IV. This is the way. So they will think about it, say, oh, really? Immunization. You're giving them immunization. This is what Superman would do. He likes, as a Superman, he needs some immunization to grow and get bigger, you know, something like that. But you don't lie to them, okay? And you explain to them, okay, as much as possible. Any question? So the school age people, you know, they're bigger. So they're bigger. They know what is going on. So you can't even lie to them. So make things simple, okay? Simple as much as possible. And don't lie, the same thing. And be truthful, okay? Don't lie. If it's going to hurt, please tell them. This is going to hurt. But I will provide you some pain medication. That's all. You explain it to them. It's going to hurt, but we will do the best we can. This is what we're going to use. You have to tell them about the instrument too, you know. Say, this is what we're going to use. We're going to use this IV line, and then we're going to do this. It's going to hurt. After that, we give you some pain medication. You know, you don't need to tell a toddler like that. You don't need to tell a preschool, and you don't need to tell an infant. Like, that's how you think. These people know what is going on. They are aware, and therefore provide direct, talk to them, but in the simple way, not in adult form, simple as much as possible. It's going to hurt. This is what we're doing. This is IV. We're going to cut down and put it in. That's all. And you're done with them. Then the adolescents, you know them, they having issue with identity and all those things. So the body image is very important. That's how, when it comes to procedure, this is how, when I'm dealing with these patients, this is how I think about these youngs. I mean, you don't have to worry about adolescents. I deal with adolescents. So body image is very important as they try to develop. So pay attention to that. In your answer choice, looking for anything that will affect their body image. So they're thinking about it in terms of pain. So just be able to explain it to them. You explain to them the scar, and then let them know about what is going to about it, what is going to happen. They're not going to lose their height. They're not going to, the sky is going to heal. Nobody going to see, you know, but you don't lie. But body image is the key aspect when it comes to procedure for these people. You know, there's so much information, but like you got to grab one keyword that, you know, adolescent, when I'm dealing with them, body image with procedure. So every answer choice has to go in that line form. Okay. In the preschool, we have to think magically. Okay. Anything else? So what do you think? These two, school, preschool, and the school age and adolescent, factual information, you tell them the plan of care, you let them know what is going on, and then you let them be able to take care of themselves. I mean, it's very important that you let them do that. Okay. Let's see, we clean this. We're almost done. So when they are in the hospital, okay, it's very, very important that you treat them in the way that is supposed to be treated. It's very, very important. So if you have a kid who is 1 year old, hospital setting, you have to know what to do with these people. So in a hospital setting, infant, well, there's so much you can do, right? There's so much you can do. Who do you think is the big person over there? Take care of the mommy, okay? Mommy feel comfortable. So I will focus on the parents rather than the kid, because there's so much. You can't talk to the kid. So parents, so you take care of the parents, and then that means you're taking care of the baby, basically. The toddlers are different, okay? So toddler 1 to 3. So when they get to the hospital, like you said, it's very important. They feel when you keep things normal as much as possible. So you need to see, this is, I call it normal. So normal, I'll put normal 3 times. Let the parents stay, okay? Parents stay, but make sure things are all normal. And what does that mean? Instead of the 4S for infant, when they're doing a procedure, this one you can use R's, because if you look at the question, they use that buzzwords. So rituals, you know, you have rituals. When I see rituals, I'm fine with it. If I see routine, yeah, okay. If I see like kid is rested, yeah, that's normal kind of thing. And the reassurance, okay, you reassure them. These are the 4 F's and R's you should be looking for in the answer choice. A toddler in the hospital admitted, what am I looking for? ritual things. So the things that they used to do, you're doing your routine things for them. You're making sure they all rested, and then you are reassuring them everything is going to be fine. Okay. And you have to give them options. Okay. Give them options. Do you want this or that? You know, just don't give them two options. You have to give them two options, and then they will choose one, and that will make them feel really, really, really comfortable. Okay. So give them two options, and whatever they prefer, you give it to them. That's prefer is routine. Okay. And things that they do at home, you keep them as much as possible. So routine means your house look the same as your hospital. So if they want toys, certain toys, yeah, put it there and keep there. But these questions can be tricky. So if a toddler, keep everything normal. Ritual, routine, rested, and reassurance. And you do that, and that will help the kid in really, really well. They will be able to cope with the hospitalization. They don't have to be in the hospital, but you want to keep the area really, really better so that they know what is going on. If you don't do that, what do you think? The kid will feel like you're being separated from parent. So they develop separation anxiety. And when you develop separation, like what will happen? They will regress. So regression. Another R. We don't want this. We want to keep things ritual, routine, rested, and reassured. Otherwise, they get separated from their family and they regress to the point that you don't want that. And so that's why we want to avoid regression as much as possible in a toddler who has been admitted. So your priority action is to prevent regression in a kid admitted to the hospital, a toddler. How do you do that? By making sure everything is in a routine form. You perform your ritual, like they rested, and then you are reassuring them. Okay. The preschool is different. Okay, the preschool. They are the magical thinking people. So do things the way it should be magical. Because they think like that, they think like everything is magical. Well, if I'm in this place, I'm being punished. So this is punishment. Punishment for them. And you have to let them know that this is not their fault. It's not punishment, not punishment. Okay? Then it's not your fault. Certain things you have to do. It's not their fault. They're here for a reason. We are here to help you and fix the problem. These are key. I don't know, these questions are really hard, but if you know these things, subtle things, you'll be able to distinguish between the answers. They think it's a punishment, it's their fault. So they're blaming themselves. You tell them, no, it's not. Then you go back to their problem. Everything is magical, even death, medication, IV procedure is all magical. So attack their weak point. You attack their weak point by being magical in your thinking, okay? So give them things, show them things that are magical, like a puppet, you know? You make things that is magical for them, okay? That's all. If they're going to have an IV and you know they're going to cry, well, you make it magical. You give them, you know, sometimes you take your kids to the hospital, they give them a postage stamp or some bandage. Yeah, they're trying to make things magical as much as possible. You put the same bandage on your hand, and so that they know how it's going to feel. So magical, I'll call it magical as much as possible in terms of how they think. The school age, I think, is the same as the toddler. You go back to them, school age people. They don't want to be in the hospital, okay? They don't want to be there. I see them as the same as the toddler. So you go back. What does the toddler do? Routine, ritual, rested? Yeah, the same thing. So you make sure they do their daily routine. Whatever they do, yeah, keep on doing it. If you talk over the phone, 10 hours, oh, good luck with that. You can go that. So daily routine, let them do their schoolwork. This is the key. I won't forget this schoolwork, because if they feel like they're falling behind their peers in school, and they are here enjoying themselves, give them their schoolwork, homework, let them do it, and so that they don't fall behind. That is the key. You should not let them do that. Let them be retuned like the toddler, but the toddler doesn't have too much responsibility. All you need to do is prevent them from regressing. So you provide ritual, retune, rest, and reassurance to prevent regression. School age, you do the same thing, but the best way is to let them do their schoolwork. Give them 40 homeworks. Maybe that may help them. They may heal much better. An adolescent, I have one. So you spend 10 hours over the phone, midnight, still talking. So they are the people. Let them contact their friends. Okay, talk. Okay, that's the key. Don't isolate them. Their main thing is, even in the hospital, let them talk. Give them their phone. Okay, because they have achieved identity, and so you let them stay that way. And those are the what you deal with them, how you deal with them, in terms of what do they call it, hospital setting, and some of the changes that will occur. Okay. In terms of, let me see what is left. Any question? Oh, there's a question. Clinic, I can see. Oh, what was the question? Have friends visit in the hospital? Yes. So if the hospital allowed, okay, but they can talk to them over the phone, contact friends. The hospital can also, if they allow them, yeah, they should be able to come and see them. You should let them do that. And then lastly, I don't know if it's lastly, I can't clean this. There is an effect of hospitalization. Think about it. These kids, like, all of a sudden, they have to be hospitalized. So effect. Let's talk about that. I think I just remember that one. Effect of hospitalization. I think is very important to know that. Infant, what do you think? Infant who is being hospitalized, what do you think happened? They don't know what happened, so they can't describe the illness. Can't describe it. So they have no clue. They can't describe the illness. They just follow whatever direction is happening. They lack understanding of whatever is happening. So they have no clue. Right? And therefore they display physical behavior that is basically to show comfort, basically to help them cope with that. A toddler is different though. A toddler will do different. A toddler, basically, they have limited understanding, but the experience is the same. Major one is the separation I told you about, separation anxiety. So that's why you want to prevent them from regressing. You provide a routine environment for them. And a preschooler, they have a limited understanding, and therefore they worry about the body being harmed, and they blame themselves and all those things. So it's very important that you distinguish between all of them. And then the adolescent, they know what is going on. Like I said, body image is key for them. Let's see what else we have. Okay, so I think that was it.